Hey guys, this is Dr. Watt from Attain St Chiropractic. Let's talk about two of the best modalities that you can do for your sciatica. Now, as we've already talked about, your sciatica is from your sciatic nerve. It's inflammation of the sciatic nerve. And it comes from L4 all the way down to S3. So it's these 5 nerve roots that come all the way down and go all the way down the leg. And so that oftentimes can mean there's entrapment in the low back, in the hip, in the leg. But either way, you're oftentimes getting symptoms more than just in the low back. And so when we treat with these two modalities, we want to figure out how can we treat not just the low back, but also everything else downhill from that. So we're going to move Alfred out of the way here. It's the two best modalities we do. First one that we're going to talk about is shockwave. And we've talked about this with a lot of our other treatments as well. But when we use shockwave for sciatica, first thing we're going to do is treat the low back. And so this is going to make a loud thump, thump, thump. And you can hear how that thumps and is making that loud percussive noise. And that's almost like a massage type effect. But what it's doing is breaking down those tissues and those tensions that are pinching that nerve either here or across wherever it's coming through. And so we'll do this all the way along the way of where you're getting your symptoms. The other modality that we're going to use that works really, really well in conjunction with that is our laser. Once again, we've used this with a lot of other conditions as well, but this is one of my favorite things to use the laser for. The laser uses infrared light, and that infrared light is going to penetrate 2 to 3 inches deep into the tissues. What that then does is increases oxygenation, circulation, essentially increasing blood flow to those tissues. And why this works so well on sciatica is because, yes, it's going to treat the muscles, it's going to treat the joints, but it's really going to drive up the healing process in that nerve. Nerves are notoriously challenging to treat. And so when we use something like laser, it's increasing blood flow to the nerve specifically. So when we use sciatica treatments through the laser, we're going to treat here, and then we'll have that patient dressed appropriately so that we can move all the way along down the leg, even down into the feet for those patients who are getting those extreme issues. So we start with the root of it and anything else downhill. So when we compare these two modalities together, we're going to break it down, clean it back up, and you're going to feel brand new. So these are two of the best things that you can do for your sciatica. If you want to know more about them or figure out how these can help you specifically, come on in. Let's chat about it.